Welcome back, everyone. I'm your host, Dorothea Howard, for the show Let's Talk Sarcoidosis. To my left is a very special guest co-host today, Mr. Richard Hanner. Thanks a lot for being here today.
Thank you for having me.
And today we have an exciting show. We have Dr. John Howard from the Maryland Acupuncture Clinic. Welcome, Dr. Howard.
Thank you for having me, Dorothy.
We're glad that you're here today, and we know we're going to have a great show and some good information for our viewers. Dr. Howard, how long have you been practicing acupuncture?
Just a little over 10 years now.
Mm-hmm.
I've been doing acupuncture strictly in my practice for 10 years at the same place in Gaithersburg, Maryland.
Mm-hmm.
And prior to that, I did Western medicine.
Oh, okay.
Trauma medicine.
Wow, that's interesting. So what got you interested in becoming an acupuncturist?
It's kind of a funny story, unique.
Mm-hmm.
Many years ago when I was in high school, I wanted to become a world-class runner. My mother said, well, you need to have a job too. Like that was a part-time hobby.
Mm-hmm.
And living in South Florida, I would train at night my senior year in the summertime. When I came back from my run, it was late at night, so I was cooling down, waiting to go to sleep, and I saw a show on acupuncture, and I was really amazed on what they were able to do. Somebody was having surgery, I believe somewhere in China, and they were doing surgery on the patient, and the patient had no anesthesia, just acupuncture, and they were wide awake for the operation, and I thought that was the neatest thing. So I thought, well, this is really a good idea. Now that I got my career, along with running, my mother would be happy. So the next morning when I saw her, I approached her and I said, I know what I want to do now. And she said, why? And I said, I want to become an acupuncturist. I saw the show last night and it was really cool and it's something I want to do. Mm-hmm. And my mother just looked at me and said, you don't even look Chinese. And don't tell your stepfather because he'll have your head examined.
Right.
So that's how I really got interested because I was always very fascinated and curious. Mm-hmm. So I went the Western medicine route. I went into the military. I served in the military for a number of years, and then when I got out, I was a physician assistant. When I was working at George Washington University Hospital, a patient came in to see me, and I saw him a few months back for some back pain. Well, this time he came in, he cut himself, so I was suturing him up, and I said, well, last time I saw you had back pain, how's it going now? And he said, well, it's fine. I went to go see an acupuncturist down the street and cleared up my back pain. And he was on some heavy narcotics that we put him on, so I thought, well, you know, I have some foot pain, I was a runner. So I'd go see an acupuncturist, and I did. And I went to go see one, and I was really impressed and amazed. And I always wanted to do it, but now I got to that stage where I was able to do it, you know.
Right.
So that's how I kind of got involved. And I took a 5-month course over at NIH to kind of get your feet wet to see if it's something you like, and it was something interesting. And they had a school in Bethesda. So
really?
Yeah.
Oh, okay. That's news. I didn't know that. Well, tell us a little bit about acupuncture.
Sure. It's been around for thousands of years, as you know. It's probably one of the oldest forms of medicine out there, and it works on your own body strength. It basically activates your immune system to make you healthy again. So if a person comes to see me with pain or any other condition, what we do is we work on their body, work on the immune system to strengthen that so that the body can take care of itself. It's a great healing machine. It's probably, when it functions right and correctly, it's one of the best forms of medicine out there is your own immune system.
Right.
So really, acupuncture in a nutshell is your own immune system taking care of itself. And as we get older and we get sick, it starts to break down. We have different conditions and different pathologies that come into our body every so often. And with acupuncture, it's a way of correcting it. And if it's not too late, if you're not into like a degenerate stage, then acupuncture can be a great help, or even an adjunct to Western medicine if you're getting therapy or any other type of modalities in Western medicine. It's a great adjunct.
Oh, okay.
Okay, and what area do you practice?
I specialize in pain management, chronic conditions that people have had for a long time, such as you might have a back pain, you might have stomach problems also, you might have chronic headaches. People have like real complex things. I specialize also in headaches, and one of the other things I specialize in too is children and also sports endurance. I use acupunctures to make people more endurant. You know, they can run farther, they can swim farther. You know, that's one of the techniques I'm using. I'm using one next week. One of my patients is going to a world championship in the 100K which is 62 miles in the desert.
Jeez.
So he's going to need all the help he can.
Is there anything else acupuncture is good for?
It's good for a lot of things. I mean, it's good for overall health. It's great for sleep. One of the benefits or one of the side effects of acupuncture is you can come to see me or any acupuncturist, and you go and that night you go home and you just feel really good and you get a good night's sleep. So a good night's sleep is very important. So if you can get somebody to sleep, the immune system can take over and heal the body. So one of the side effects or benefits is a great night's sleep. So that's really a great side effect that most people overlook, is the sleep aspect.
What is the average number of treatments for a patient?
Well, that's a good question. It depends on their pathology. If you're 18 or 19, 1 or 2, you know. But as we get older, like now myself, when I kind of get injured, you know, I take more time to heal. The average person, it's kind of like a course of antibiotics, we say. You know, 12 treatments, if you had something for longer than a few months, is about a fair estimate. We can get it under control where you're feeling less pain or more energy within about 2 to 5 treatments or so, and you'll notice a difference. Sometimes after the first few minutes, you'll notice a difference. But to get back, about 12 treatments is a really good estimate of how long it will take, you know,
Right.
especially if you have something for a long period of time.
You know, we talk about acupuncture. Does it hurt?
Oh, absolutely not. Absolutely not. And that's one of the other things that most people think about, is that, you know, you're going to stick a bunch of needles into me. The interesting thing about acupuncture is that we use a needle, but it's not the same needle you use in Western medicine.
Okay.
When I was doing blood draws or starting IVs or giving it a vaccination, that needle has at the end of it a little hole called a bore. And it's that little bore that kind of will create a little bit of blunt trauma that will probably cause you a lot of the discomfort you feel.
Right.
Acupuncture needles, they're called filiform. It means they come to a point and they're really thin. Some of the needles I have are as thin as hair, and if you blow on them hard enough, you can actually see the needles bend. And when we're doing our demonstration, I actually have a, I believe it's a 16 gauge needle that you get your blood, you know, you get your blood drawn. Well, inside the bore where they draw the blood out of, I fit 11 acupuncture needles into that little hole. So 11 of my needles can fit in just to the bore of a regular, you know, hypodermic blood draw needle.
Wow, that should be comforting for those who are afraid to get acupuncture because they're afraid of needles. And that was actually my next question, because I was going to ask you, how does the acupuncture needles differ from the regular needles that you have your blood drawn?
Sure. Like I said, they're much, much thinner. Just like with Western medicine needles, they're one-time use. They come in a sterile package, so once they come out of the sterile package, they go into your body. They're removed and put into the same container as any other needle. It's called the Sharps container.
Right.
But the difference with these is they're very light, they're very thin, and a lot of times you have needles on you and you fall asleep. And most people I'm not going to fall asleep with no needles in my body. I mean, it's not uncommon to kind of have a really good sleep session while you're getting a treatment, because you don't think about it. When most people think of acupuncture, they think of needles and they think of a porcupine, they think of all this other stuff.
Yes.
And you know, and I understand, because even I, in the beginning, I thought the same thing too. I'm like, you're going to stick me how many times? How many needles? I have in some of my training material that because I teach also, I show, when I teach the public, my daughter, who was 4 or 5 years old, who has acupuncture needle in her hand, just walking around showing people in her hand. So it doesn't hurt. And a lot of times you don't feel it going in. What they will normally feel is a heavy relaxation in that area, or overall body relaxation once needles are in, it's a really common effect.
Yeah. Wow.
I know it's kind of hard to believe, because you're thinking needles and
I'm trying to picture that in my
something
mind.
sharp going in my body. This ain't making sense. But anybody who's had acupuncture will tell you that. You know, some of my patients come in and they're like, I got to tell you something, I don't like needles. And I said, well, good, either do I. You know?
Right.
You know,
I mean, I know people that swear by it, you know. But now, are the needles sterile, and are they needles that you reuse over and over again?
No, the needles we use are actually sterile. We don't reuse the needles. There are some places in the world, I believe in China, that they say that the needle actually gets its energy or its power after 100 insertions into the body.
Wow.
Well, that was disease, and that's something you wouldn't do today. Even if it is true, I mean, that's something that I wouldn't take the risk of doing. The needles that we use come from in a sterile package. They're sterile, and then once they leave the package, they go right into your body under a clean technique, and then once we're done, we take them out and put them right in the Sharps container.
Oh, okay.
And I've rarely seen any blood on any of my patients when you pull the
Right.
needle out because, like I said, it's just a filiform. There's no bore. You're not going to see like that, hold a cotton ball or something over your
Right.
head or anything like that. You don't see that.
Okay.
You don't see it at all.
Wow. It's interesting. Oh, I'm sorry. One other question.
Yeah, sure.
How long did you have to go to school for something like this for an acupuncturist?
Most schools are anywhere from 3.5 years to now they have them up to 5 years. My school was almost 4 years. It was 3 years and 9 months.
Okay.
It was an intensive 5 days a week course. I
bet.
had background in Western medicine that helped out,
Okay.
but I still had to go the whole entire almost 4 years.
Wow.
The first 3 years were basically class work, and the last year was class and some didactic work and some clinical work together. So it's a 4-year program. It's
Okay.
it's most schools. I actually did the research just recently. There are about 3,500 hours of actual schooling to become an acupuncturist on top of your bachelor's degree. So once you have a bachelor's degree, you have to go back.
Okay,
So
and do
it's
that.
it's
Right.
it's a science now. I mean, it's a couple
Yeah, I
thousand
believe
years
that.
old.
Yes, I do believe that.
And what should a patient expect during and after treatment?
I think they should feel relaxation. I think I would expect them to feel relaxed, calm, a good night's sleep. I usually tell my patients, don't go to Zumba. Don't do anything normal out of the normal you wouldn't do. Don't come to me and say, I want to go for a hard run, so I'm coming to you for your relaxation. Just do what you normally would do and just take it easy.
Okay.
And sometimes some of the responses I get from patients are like, I feel fine, but it feels like I drink a glass of wine. I feel that calming
Really?
effect. Yeah, I feel
Wow.
really nice and calm. The body's just releasing chemicals and endorphins and all sorts of other good stuff that we enjoy that makes us feel good, and that's the effect. And they
I'm
usually
missing
go
out.
home. Yeah. There you go.
How long does the treatment last?
Usually the most treatments, they last anywhere from a few minutes. If we do a ear acupuncture, upwards of about 30 to 35 minutes for body if you're laying there. Most people just like to lay down on the table, get some needles in them. It's a relaxation thing. The ear, when I do ear acupuncture, I can take away your pain really quick. But sometimes they say, well, you took away my pain, but I still got to go home to my family, and it's going to be stressful. Can I just lay on the table with some needles and with me for half an hour? So it helps out. So it depends. But most patients I see are about 30 minutes in length.
Okay, well, listen, don't go anywhere. Stay tuned. We are going to have a demonstration. Welcome back, everyone. And look, my co-host and I have our acupuncture needles in, and guess what? It doesn't hurt. Does it hurt?
No, it feels great.
So this is why we need to go to an acupuncturist and to make sure that we get this treatment and we can relax and enjoy the treatment from Dr. Howard. Dr. Howard,
Yes.
let's start with the acupuncture demonstration. We're excited.
Sure, we got our model today, and today we're just going to give you just what a simple acupuncture treatment looks like. And today, since our patient's pretty healthy, we're just going to do a relaxation treatment today. So what we're going to do is we're going to first use some alcohol to clean the areas of the skin that we're going to put the needles, and just a regular 70% alcohol swab or isopropyl alcohol with a cotton ball is fine. So I'm just going to go ahead and just clean up the areas first. Give that a minute or so to dry, and then as they're drying, I'm just going to take the needles out of the sterile package, which I was telling you guys about before. They come in a sterile package, and they're good for about 5 years.
Okay.
And these needles expire in 2018, so they're still very good.
Okay.
As you can see, they come in this nice blister pack that's sterile. So what I'll do is I'll just start taking the needles out, get a couple in my hand first, so I can just move my way down from the hands.
So, Dr. Howard, where are the needles placed? Are they just in the body?
No, they can be placed in the body, but they also can be placed in the ear, especially for pain. That's a really fabulous technique called auriculotherapy. If you have pain in the ear,
Wow.
pain in the body will take any place in the ear. It can treat a lot of places in the body. There's a scalp acupuncture, and there's even a hand acupuncture called Korean hand acupuncture.
Okay.
And just like with reflexology with the feet, these are also some other what they call microsystems.
Okay.
And my favorite is the ear. So today we're just going to do a general relaxation treatment on our patient today, and she's going to get some basic body acupuncture.
Okay.
So we're just going to start off, and she's not going to really feel anything. She's just going to feel the needles in there. And we just put them in just deep enough so where they just stay up like that.
Okay.
And I'm just going to work my way down.
How's that feel, Sarah?
I can't feel anything.
Wonderful.
It's pretty painless. Most people don't feel this. Like I was saying earlier, they usually will fall asleep while they're here. And that's how I can tell. After the treatment's over, I'll say, "Do you snore?" And they'll say, "How did you know?"
Jeez. Well, I can't think of anything more relaxing than that.
Just go to sleep while you're getting your needles in.
Are there different styles of acupuncture?
Oh, yeah, there's many different styles. There's the Chinese style. There's a system called French energetics, which deals with meridian-based acupuncture. Instead of looking at the person's internal organ symptomatic symptoms, they look at the meridians that run through that part of the body
Okay.
that are affecting those organs. They also refer to the symptoms point prescription. With the French energetic systems, is if you're having pain in your stomach, they look at all the meridians that run through the stomach and all the meridians that correspond to that.
Wow.
So as you can see, our patient here has just about all the needles in. As you can see, they're in very shallow, less than a half an inch each one of them. She'll just lay here now for about a half an hour or so and just relax. And in my clinic, they just come in. I put some nice mood music on. I have these nice twinkling lights.
Oh, wow.
And they just lay there for half an hour and on a nice table. And sometimes some of my tables actually heat it with something called a biomat.
Oh.
It gives out some nice
That's
heat.
very relaxing.
You listen to music. So it's more of a relaxation. And like I said, if you can get your patient just to sleep, the body shuts itself down and the immune system takes over. And what the acupuncture does is it helps do that.
Okay.
That's how it works in a nutshell. And if you have any pain, we would address different areas. If you have back pain, or such as any type of internal conditions, as we were talking earlier about the sarcoidosis. A lot of my patients who have sarcoidosis, they are always on prednisone. They always have inflammation issues, and acupuncture works great with that.
Okay.
Especially when they're under the care of their Western medicine provider or their primary care physician.
Right.
So it works really, really well. It's a hand in hand. They have a really good synergy together.
Okay.
What should someone look for in an acupuncturist?
Somebody who is qualified to do acupuncture. I know in different states they have different laws, but you want to look for somebody who's nationally certified, and that certification is called NCC AOM. It's National Credentialing, and you can find that at their website, nccaom.com or .org also. And you just want to make sure that your acupuncturist went to school and that they know what they're doing. That's a really important thing to look for.
So after graduating, is there any other studying that you have to do?
You can do a lot of other studying. You can do continuous education programs. Myself, I was lucky enough to be fortunate enough to join a fellowship with the Air Force under a physician who invented an ear technique that's now being used in the military, which we go around the world and teach. So I was very fortunate enough to do that. Some other acupuncture schools do have some fellowship programs. It's not very big like in Western medicine, but it's starting to catch on.
Okay.
So the other thing is that they have to have so many CMEs or continuing education hours per year. I think it's in the state of Maryland. They have to take upwards of 20 hours per year to continue on with their skills, which is good for the population.
Yes, absolutely. And I know you probably talked about this a little bit earlier, but where can someone learn about acupuncture?
Oh, there's a lot of great places out there you can go to. You can go to acupuncture.org, acupuncture.com. There's even a book, Acupuncturists for Dummies. I mean, there's all sorts of books you can find. What you really want to do, you can even check the internet and just type in acupuncture, and you'll be amazed. You'll be surprised about, there's a lot of myth about acupuncture because, like I was telling you earlier about my mother, it's an ancient Chinese secret. And it's really not. It's one of the oldest forms of medicine that is still in existence today.
Right. So anyone can actually learn
anybody can look it up, and the best source of information is find an acupuncturist and go ask them questions.
Okay.
Because sometimes just reading stuff online is not going to answer all the questions you have, or you need to see it also like you're seeing here today. It demystifies the whole acupuncture myth.
Okay. And because the show is called Let's Talk Sarcoidosis, this really doesn't hurt. So anyone that's watching that has sarcoidosis, this acupuncture needle really does not hurt. I mean, I don't really care for needles, but I can tell you right now that I can definitely go to Dr. Howard's office and be on a table like Sarah and get the acupuncture needles, because everyone needs relaxation. We with sarcoidosis, we have pain, body pain, aches, and pains all over. And you have sarcoidosis patients.
Sure.
So just what else do you want to tell us about the benefits of people coming to the office and to any acupuncturist that they find?
Well, such as with sarcoidosis, if they come and get acupuncture as they're being followed under the care of the Western medicine, it can actually help. Because a lot of times your patients are taking a prednisone or a steroid or medication, and what acupuncture can do is kind of help lessen some of those side effects of the steroids.
Right.
And there's a lot of them. But it's an important part to get to medication, but acupuncture can actually help with some of those side effects. And sarcoidosis is a serious condition, as you all know, and it's something that is managed well with acupuncture, and especially, like I said, when the synergy between Western medicine and Eastern medicine are combined, it really helps the patient, helps them heal quicker too.
And I'm really glad that you said that sarcoidosis is very serious, because there are so many people out there that don't feel like this is a serious illness. I don't know why, but I do appreciate you recognizing the illness. And because you have patients, so you do understand.
And even,
yeah.
Even if you're, some of the patients I've seen, they don't have any symptoms of the sarcoidosis, but it's in their eyes sometimes, their heart or their brain, and even if they're asymptomatic, means without symptoms, they should be followed under the care of a physician, still be treated even though there are no symptoms, because it is that serious. You don't want this to get out of control, because if it does, it is going to be a real problem for that patient's long-term health in the future. So you don't want something like that to kind of run its course.
And for something like this, when do the patient feel feel it working? Does it take maybe 30 minutes or 15 minutes? When do they actually feel it?
It all depends on the person's individual pathology, what their conditions are.
Okay.
For something like relaxation, if you come from a really crowded office or a hectic job, it may take you 15 minutes. If you come and you're in a lot of pain, I do some ear acupuncture or auricular therapy, you might notice it in literally like seconds.
Wow.
So it can be anything, any length of time. It all depends on the patient's pathology. The longer they're revved up, probably the longer it takes for them to feel the effect. I'm sure Sarah's feeling the effect now. It would be nice if she started to snore on camera for us. Then you can see it's really working. But she's probably trying to stay awake for this. But you would see by now, if we weren't talking, if she was in the room that's nice with some music, you would see probably a deep relaxation. You can just see them melt into the table.
Wow. I wish we had music. So is there anything else that you want to say in regards to the benefits of acupuncture before we...
There's so many benefits. Even if you are healthy, regular acupuncture treatments can keep you healthy. It's one of those old sayings, don't go to the doctor when you're sick, go as you're healthy, so continue with the health you have. So one of the other things I'd like to say is, if you're looking for an acupuncturist, the best way to find one is you can go to a website called AcuFinder, AcuFinder.com. And in there you just type in your zip code wherever you live, and there'll be a whole list of qualified acupuncturists. So if you don't, my mother has a friend who's an acupuncturist, in Southern Maryland, and that's the only one you know of, well, now you have a place to go that has acupuncturists in your area and in your zip code, and you have a whole list of them, and it has a lot of information on their background and what they specialize in and stuff like that. And that'd be a really good starting point to find a good acupuncturist in the area, especially if you're thinking about it.
Right. Well, that's some good information.
When a family member or friend is diagnosed with sarcoidosis, it affects everyone. We must all work together to find a cure. Please support sarcoidosis research.
And once again, I'd like to thank Dr. Howard for coming to the show today to enlighten us about the benefits of acupuncture, and also Sarah Howard for being on the table today and showing everyone the demonstration and how it really doesn't hurt. And as I always say, We all have sarcoidosis, but sarcoidosis doesn't have us. So until next time, be
Be blessed.
blessed.
Thank you.
Thank you.